If you're looking for a nursing job or you've got an interview coming up, you need to hear this. I'm going to tell you in my 3-part series how to absolutely ace your NHS nursing interview. We're going to have a look at scenario-based interview questions that the NHS interviews are made of. We're going to have a look at the questions that you should be asking them and the interview etiquette that's going to be the difference between you getting that job and another rejection. I am a registered nurse and I have 11 years NHS experience. I have been on both sides of that interview panel and I know the categories of questions that they're going to ask you and the buzzwords that are going to make you stand out and score more points in that interview. In the UK at the minute, we have a crisis and a recruitment freeze on NHS nursing jobs. So if you manage to get a job, they are very few and far between, but if you do manage to get a job, you are going to be competing with hundreds of other nurses. You absolutely need this edge. So today we're going to have a look at scenario-based interview questions using the STAR framework. Now, to make it easier for you guys to follow this and practice, I have made a free download for you on my website. You just need to head to www.shiftwithshan.co.uk, click the free resources tab and download your free STAR framework. Pause this now, go and do it, and then you can use that as a prompt as we are going through the structure of this NHS interview. So what do we mean then by scenario-based interview questions? These are the questions I can ask you. For example, they could say, how would you cope in a high pressure ward environment? Or they'll give you a scenario. For example, they could say, you've got 2 HCAs, they're in the bay arguing, how do you approach that situation? Now, they're expecting you to tell them of a time where you've experienced something similar. If not, and you haven't experienced that, you need to tell them what you would do in that situation, because you're likely to be exposed to that kind of environment when you get this nursing post. So why do they ask these type of questions then? It's because they want to know that you are going to do that right thing when you get this nursing post. They're not going to employ anyone who says, I'll just let them scrap it out in the middle of the bay. It's not going to happen. They want to know that you are going to do the right thing, and that's why it's so important that you answer these questions right. And it doesn't matter what your paperwork and your CV says. Reciting textbooks is no good if you cannot cope in a situation that is a real life situation. So let's look at a question then, so you can be prepared in how you would answer it. Let's use the example of the 2 healthcare assistants in the middle of the bay who are arguing. Now, this kind of question falls into a common category of NHS questions that they are going to ask you in interview, and it falls into conflict resolution. Other questions that you could be asked in this category include, you've got an angry relative, a confused patient, a passive-aggressive co-worker, or patients or colleagues are arguing, and how would you approach that situation? Now, conflict resolution is on the to ask questions, especially if you're going for a nursing post, and that is because, unfortunately, we see it so often. So most of the time we meet our patients and their relatives and they're having the worst day or one of the worst days of their life. So they're usually in pain, sleep deprived, they're anxious, they're stressed. It's a highly emotive environment. And whether you're working in a hospital, an outpatient or in the community, we're going to see some kind of conflict that we're going to have to resolve. The STAR framework then. So let's use the example. You've got 2 HCAs in a bay arguing. Now, STAR stands for situation, task, action and result. Situation then. This is where you'd say, if I heard 2 HCAs arguing in a bay where patients could hear them, really all you're doing there is setting the scene. It's a really big, easy tick to get because it shows that you've listened to the question, because you're going to get delegated things while you're in your nursing post, and what the interviewer wants to know is that you can take that information, retain it, and you've understood the assignment. Basic, easy points to get. Next is task. So you've set the scene, then you'll say something like, as the nurse, my priority is patient safety and dignity so that the care isn't compromised. Here, the task really, what it wants you to do is to explain that you know your role and you know your responsibilities. And really here you've also reinforced the code of conduct, which is always a nice, easy tick to get. You've also said here a lot of buzzwords: patient safety, dignity, and that the care isn't compromised. Next is action, and here you would say something like, I would stay calm, but I would quickly step in and politely and calmly ask the healthcare assistants to remove themselves into a private area away from these patients. I'd then apologise to the patients and reassure them that their care will continue. I'd go back out then to the healthcare assistants and explain and ask them to explain their side, and I wouldn't be judgmental about what they said. But I would tell them that it isn't appropriate to be arguing in front of patients. I'd then draw on their strengths and explain to them that teamwork is at the heart of good patient care, and they both have a really big part to play in that. If I couldn't resolve the argument or the disagreement they were having, I would then escalate to either the nurse in charge or the ward manager so they could help to resolve this. What you've done really there is you've done what they have asked you to do. You are going to de-escalate the situation. Big tick there. You've been calm, you've also been fair and non-judgmental, and you've also been really professional. They are all big ticks and high scorers, and easy for you to say in your interview. It also gives the interviewers an insight into your character, and these are the character traits that they want in their team. Next is the result, and this is where you say why you did what you did. So you'd say something like, by addressing the situation promptly and professionally, patient safety and dignity were preserved. Also, the situation was de-escalated and the healthcare assistants felt heard also. I created a professional environment showing that patient care is really the focus. Now, what you've said there is that you've demonstrated a really good teamwork ethic, that you are patient focused, and also that you know your limitations, because you've said that you will escalate if you cannot de-escalate that situation. All these are high scoring, big fat tick buzzwords that you need to be using in your interview. So as you can see, using this STAR framework, it gives you a structure to follow. That means you don't miss out on scoring for saying those buzzwords, but also you don't go off on a tangent and actually forget what they asked you in the first place. Now, you know this STAR framework, you can actually apply it to any category of questions, not just conflict resolution. And there are many categories of questions that they might ask you in NHS interviews that rank high. These include questions on communication, patient safety, teamwork, any of the 6 C's, time management, and making mistakes. Any of those scenario-based interview questions you can now answer using that STAR framework. So now you've got the skills and the strategy to use that STAR framework with your prompt to answer any NHS interview question that is scenario based, and you can use your own experiences with them. So the actual scenario questions for your interview, you've got this. But it isn't just about the questions that they ask you. It's also about the questions that you're going to ask them. Now, when I say at the end of your interview, any questions for us? Rather than freezing, you need to know those questions that you can ask them to make you stand out in your interview. And that's exactly what we're going to have a look at in the next episode of this interview series. I'm going to put it on YouTube. It's going to drop on Monday at 9 AM. So don't forget to subscribe and click the notification to make sure that you don't miss this. Until then, be kind to yourself. We have got this.